Have you ever found yourself elbow deep in a bag of chips or chocolate chips, standing in your kitchen, and then wondered, is this a problem? Do I have a problem? Is this binge eating? Do I need to worry about this? Or maybe you know the guilt and the shame that comes with that all too well. If you recognize yourself in that situation, you will definitely want to tune in to this week's episode with Stefanie Michele, who's a health coach, an occupational therapist, and a binge eating and body recovery coach specifically. And I knew that she was the perfect person to talk to about some of the challenges that we face at any stage, but especially in midlife around emotional eating, emotional hunger. We define what binge eating is, what binge eating behaviors are versus binge eating disorder. And we talk about why it's not about the food. And I think it's a really important conversation to have because we so often hear that binges are caused by something in the food or the foods themselves, or that there's something wrong with us, that there's something that is broken inside of us. I know that you're going to love this conversation. And I'd love to hear if any parts of it really kind of resonate with you and help you to maybe move towards a more peaceful relationship with food. You can leave your comments in the comment section on YouTube, or you can send me a text wherever you listen to podcasts. I would love to hear what you think. Hi, Stefanie. Welcome to the Midlife Feast.
Oh, thank you so much for having me. It's good to see you.
It is great to see you. You were a guest in the Midlife Feast community back in December, which was great, talking about emotional regulation and stress and body image and how that all plays together. And we're going to be talking about a related topic today, which I know the audience and listeners will be very keen to listen to because there's a lot of misconceptions. There's a lot of, limiting beliefs around what binge eating is. So we're talking about binge eating. And I always just love how you describe, how you normalize so many of the things that we've been taught to pathologize about emotional eating, binge eating. And I think it takes so much of the fear out of it. So let's dig in. So what is binge eating? Do you have a definition? Can we define it right out of the gate?
Yes, I mean, there's a clinical definition of what it is, right? So it's, eating, and this is subjective too, but large quantities of food, more than a person would quote unquote normally eat in a sitting, in a short amount of time. And there's a certain number of times per week or per month that might take place. I find this definition though, really, it's the clinical definition. And that it's also one of the mainstays of binge eating specifically is that it's followed by feelings of guilt and shame, that's part of the package. That's not just simply overeating. It's not like having an extra portion or two, or sort of overfilling on Thanksgiving dinner. That it's these discrete periods of time where a lot of food is being consumed, and that this is happening on a somewhat regular basis, and followed by these periods of guilt and shame. That's how it's outlined, at least in the DSM.
So, and just to be clear, and if I can clarify, we're talking about binge eating disorder. We're not talking about binge eating behaviors, which can happen separately from the disorder, may be related, may not be, but there is a clinical disorder, binge eating disorder, that is as you describe. And I think it's important to clarify that for people too, so that, a lot of people think that it's just a bad habit. Yeah. And they don't actually realize that this, ties into mental health, emotional health, and that there are criteria there. So that's binge eating disorder.
Yeah.
Keep going. Tell us more.
It's talking about binge eating. I'm someone who's struggled with that for 25 years, roughly. I mean, I had all manner of disordered eating and eating disorder behaviors within that, but binge eating was the one I identified with the most, and the one I feel like I struggled with the hardest. And it's, as I've worked with people over time and as I recovered, I think about binge eating in so many different ways, because it's not just this one thing that comes from one source and there's one mode of recovery. It's there's binge eating that comes from extreme hunger due to restriction. There's binge eating that comes from guilt and shame and I don't want to say hiding, but emotional restrictions of suppressing emotions and talking in very like self-bullying ways and kind of using food as what would be called self-sabotage, or I don't really believe so much in self-sabotage, but it can feel like that. Or just sort of escaping, dissociating. Sometimes it's a way of taking care of oneself and securing alone time in a world where we don't get a lot of that, or we feel guilty for trying to reclaim that for ourselves. There's so many different ways that binges present. The food piece looks the same in terms of, eating a lot of food in a short amount of time, or sometimes that can look like eating a lot of food over the course of a day and not really ever getting to any level of hunger because we're just consistently like grazing or, chronically. But that where it comes from is so nuanced, and the way of thinking about it for oneself is really nuanced. And that's why, sometimes I'll get questions like, can you give me some tips for reducing binge eating? And it's like, I couldn't possibly give you a tip. Like it's too complicated. It's very individual about where your binges are coming from. So I think there's so much more under the surface of what's going on here in that behavior what's driving that behavior than meets the eye, or than is typically talked about in sort of mainstream therapies and treatment.
And it's very closely related, almost, directly related with emotional eating. So a couple of episodes ago, we'll link that in the show notes, I did an episode on emotional hunger and emotional eating, and recognizing that, that close relationship that we have with not just the types of food, but like you were describing, the circumstances in which we crave them, and often by ourselves, often as a reward, often to take care of ourselves. We have to acknowledge the purpose that it has served in a self-compassionate way before we even think about changing it.
Yeah.
Just like you can't hate yourself into a body that you love, you can't change your eating behaviors from a place of self-loathing. It's just never going to work.
Yeah, and this is the hardest part, because binge eating inherently has a lot of shame attached to it, a lot of cultural disapproval. We live in a world in which restriction is normalized and admired. It's cool to eat as little as possible. So binge eating looks like its polar opposite. It looks like, I hear a lot of times people will describe it as selfish, greedy, gluttonous, lazy comes into play a lot for people who binge eat, even though it's the separate issue. But it's associated with a lot of not pretty characteristics and traits. And so having self-compassion, having any kind of inroad to understanding, or even wanting to understand the purpose of it, is hard won. I plan to one day write a book, and what I'd like to title it is The Wisdom of Binge Eating, because I believe that it has purpose, and that if we can get through the resistance and through the judgment of what this disorder has been made to look like in our society, that we can learn from it. And that it's really there to tell us something, whether that has to do with physiological needs that are going on in the body due to lots of times restriction and dysregulation in the nervous system, or changing belief systems, or calling attention to belief systems that aren't serving us anymore, or calling attention to emotions that need expression. Because sometimes binging can be a way of talking, of saying, I'm angry, I'm frustrated, I need something. Something is not available to me, and I'm just collecting. I have scarcity is a big part of binge eating, even though it feels like it should be the opposite. That there's messaging in there. And personally, I didn't want to know about that for a long time. I didn't have the patience for that. I didn't have the compassion for that, because all I thought about myself was that I was weak, and that binge eating was just the evidence of that. And I could not see any more than that. And I don't know that I wanted to, really, until I approached 40. Yeah. I don't know if that's coincidental or not. At just a certain point, probably not. No, I don't think so. And we can talk about that. But, when I was younger, I just wanted to beat the system. And I didn't want to have to consider it any other way than culture had taught me to think about it, and just get rid of it.
Yeah. So let's dive into a couple of the myths, because you brought up a couple that I wanted to touch on. And one is that binge eating is a symptom or a result of a lack of willpower. And you've heard this probably more than I have, but I hear it all the time. People saying, I just need more willpower. Or if we're working on intuitive eating and working to try and maybe release some of the food rules that people have, they'll say, I get what you're saying, but I can't have these foods in my house because I don't have the willpower to resist them.
Yeah.
So let's talk a little bit about willpower.
Okay. Well, I'm in full agreement with you that this is not an issue of willpower. And I don't know how you see it, but a lot of the people I work with have lots of discipline, lots of drive, lots of quote unquote, successful in other areas of life. In fact, I work with many people who sort of present that as like the conundrum. They're like, I'm successful here, there, and here. I show up really fully in my life in all these ways, except for food. And it's like, that's just the area where I'm so weak. And it's kind of like, is it? Or, is there something else going on? And typically binge eating is actually, it can be, in one of the ways it presents, is a rebellion against the expectation and the perfectionism and the extreme discipline that we're using in other areas of life or even around food, including the expectations of how we're supposed to eat. Even if you're not eating that way, there's an expectation a lot of times that you should be, and that's really
Yeah.
like a strong sort of shoulding happening relentlessly in a very disciplined way in your brain. And I say disciplined, in air quotes. But it's the response to that binge eating can often be, where it's saying we actually need to look at the ways in which we are putting a lot of pressure on ourselves to show up not only as a certain body size, and we can also go into the ways in which biology is rebelling, but also the expectations of what kind of person I'm supposed to be, how I'm supposed to eat in a certain way, how I'm supposed to be pleasing other people. Boundaries come into this a lot. There's a lot of rigidity or porous boundaries that might have to do with the binge eating, saying we actually need more flexibility, or we need more self-advocacy. Like that, it's not, willpower is just this, I think it's what fitness culture and diet culture and wellness culture have presented as the problem. And I think we've all like bought into that hook, line, and sinker. And I think that's a very misleading way to approach binge eating, because typically there's a softening that actually needs to be occurring. But and understandably, we're afraid to soften because we feel like we're so weak to begin with. And that if we take away the last shred of willpower that we're holding on to, then everything is going to fall apart. I'd also say, in response to your question about food in the house, that typically when binge eating is at play and we're working on recovering from that, there is, in fact, a period of time where you are bringing this food into your surroundings and your environment, and you are eating a lot of it because, like any pendulum swing, when you've been restricting something for a very long time, or you've been very, sort of like disciplined around something for a very long time, when you finally allow it to be around, or you allow yourself to have something, you do move towards it. I mean, that's a classic psychological response. But at that point, the people usually get scared and they're like, never mind, this is exactly why I can't do it. Like, this is the evidence right here. And it's getting through that part is why I coach, because we need a lot of help and reassurance and handholding and support getting through that part. But that's just a part of the process. That's not the end of it. That's not how we land. And if trauma is involved and things like that, there's other ways of talking about that. But that typically that's just a response to being caged for a long time.
Yeah. Well, I mean, it's like, I describe it to like a toddler, right? That, you can't trust a toddler to make rational decisions. And very much like your brain, when you're putting it in this situation where it can feel and has been a caged animal with these very tight rules and boundaries and no choice and no autonomy, and all of a sudden you're like, go for it, do whatever you want.
Right.
Of course that pendulum is going to swing the other way. But that, like you say, that doesn't mean it's where you land. We had someone in the Midlife Feast community the other week was describing how, she never kept snacks in the house. She never kept chips and things like that in the house. And so as part of the process of food permission and trying to release those rules, she brought in all the food and definitely ate a lot of it initially. She said, and now her counter just looks like a snack bar because there are bags of like half-eaten chips that have been there for a month.
Yes.
because it really does take away the reward when you are practicing permission. And permission really has to come from a place of unconditional permission, which
Yeah.
isn't earned, which
Yeah.
isn't, accounted for. It's just you have the choice. But that's
Yeah.
so hard.
It's so hard. And there's a lot of trust in the process that I think we have to have. And for me, when I went through that, I went through this through a recovery period. It was 5 years ago. It was literally the day I turned 40.
Wow.
Was the day that I was like, you know what? I mean, there was some lead up to it, but on my 40th birthday, my mom makes me a cake, this coconut like 5-layer cake, and I was like, I'm not gonna. Usually, I would compensate or restrict or not, And I said, I'm gonna eat my birthday cake, and from that day on, I'm not going to compensate anymore. I'm just gonna kind of go full on. I did like an all-in kind of recovery process, and so that was the last day, or the day before my birthday, I guess, was the last day I ever restricted. And for about 6 months, I ate a lot of food. I had ice cream was one of the things, cereal, granola, peanut butter. These kinds of foods were the kinds of foods that I couldn't have around, so to speak. That's what I thought. I didn't have them around. They were like, when I would have them in the house, I would sort of tell my husband to hide it from me, to watch me in the kitchen. I mean, these were the sort of the modes, that's the lengths I was going to make sure that because I just didn't trust myself. And when I allowed that food, I had ice cream bars in my house and I would eat boxes of them at a time. And I even in recovery in the beginning, like had a lot of ice cream bars at a time. It wasn't like I'm allowing all food, so I'll just eat one. It was like I needed to have 3, 4, 5 of them, if not more. And now I think I just threw away a box of ice cream bars that just got freezer burned because the energy around them,
Yeah.
it was like, after a while, that's the classic, I think, way that we talk about habituating foods in order to recover. And there are cases in which I think there's some offshoots of how that might look for someone. I have worked with clients who say, I've been giving myself permission to eat these things and it's not going away. Like I just continue to binge and I've been doing this for years. And that can happen too. And I think that's a common myth around like, this doesn't work for me. Typically what I see going on there is that there's sort of this idea that we're giving ourselves permission, and there's the mechanical, behavioral, okay, I'll have it in the house, but the mental restriction is still really high. So that's like, yes, in theory, you've given yourself permission, but there's a lot of judgment. There's a lot of fear. There's a lot of shame about the fact that they're eating it. And that's not quite the same as true permission. So that's an area that sometimes I find people need support around. And the other one would
totally
be,
agree.
oh yeah, go ahead.
Yeah, no, I was just going to add that permission sometimes too, I think gets confused with testing boundaries. So I often see people who will have this, oh yeah, I'm all in, but I'm testing this by getting on the scale in a week. They're not saying that, but that's what happens.
Yeah.
And then they get on the scale and then they're like, well, it didn't work. So that's not permission with curiosity and compassion. That is a test. And, there's no way to go into that feeling peaceful because you're already expecting the outcome. So you're just trying to make this a self-fulfilling prophecy. And that is a completely different mindset than I just want to normalize this food. I just want to have food neutrality, and not feel this reward, not feel this craving, this urge, this compulsion.
Yes.
Yeah, I hear that a lot from people too, and I think that's an important one to call out. So thanks for bringing that up too.
You're speaking also to like a readiness, because I tried to stop binge eating, obviously, for all the while I was binge eating, and I have this journal entry somewhere that I recently came across. I mean, it wasn't a journal entry. I'm sorry. It was an email to my therapist at the time, and I read it recently. I was like, oh my goodness, this was in 2016. So this was years before I actually recovered, few years. And I was trying this method. I don't even really remember it, but I was trying, and I wrote to her and I said, I've been doing I've been allowing myself to eat all these foods for 3 weeks now. and I haven't lost any weight. I can't keep doing this. This doesn't. And it was like, I knew that I could remember at that time that the goal was just still weight loss, and the goal was still like control. It wasn't coming from this place that I ended up arriving at several years later of like what I can describe only as like this readiness and real just desire to have this normal relationship with food. It wasn't about what I would get out of that. It wasn't about I want to have a normal relationship with food so that I can be thinner or so that I don't gain weight. It was a pure, I don't want to enter the second part of my life. I will end up doing this for the rest of my life. Like I just knew that, and again, maybe it was the 40-year mark that was sort of like, here, I'm going to enter a new decade. And if I do this the same way, I'm going to keep doing that. I'm going to be my grandmother who is 92 and still dieting. That will be my life. And I could see that. And then it became something more about, I think, my desire to feel quote unquote normal around food or feel regulated, even just internally, to not be on that roller coaster all the time, was stronger than my desire to control my body. And that was the first time that one eclipsed the other. Because prior to that point, it was like, no, the control is more important. The body is more important. And I'm not judging that. I couldn't get there until I got there. But there was this level of exhaustion that kind of came with the ability to really move into this process in a way that worked.
Yeah. Oh my gosh, that's really powerful. Can we talk a little bit about the food? Because the other myth that I think gets too much attention is that it's the food that creates the craving, and that there's something in sugar, in high palatability foods. It's the salt, it's the fat, it's the sugar, it's all the things that is creating this craving and driving this binge eating, because you can never feel satisfied with these hyper palatable foods.
Yeah.
I'd love to hear your thoughts on that.
So I don't believe in food addiction. I do believe that there are certain behaviors that we can come to rely on really strongly, and that they're our go-to and they're our default network, and that they can feel very much like addiction. But I don't believe in the actual addictive property of food. I was treated under an addiction model for a very long time. That was the approach that my therapist, and I was in treatment for this, and that was the approach. And there was an Overeaters Anonymous kind of vibe, where it's just like you abstain from the white flour and the white sugar and these things, and you'll be good. And it does work for a period of time, but that's a willpower thing. That's still using this, like it's not getting to the root of the problem. And the way that I really feel this to be true is that I used to binge on sugar and carbohydrates relentlessly. I would have absolutely told you 6 years ago at this point, I'm addicted to those things 100%. I would rustle through garbages. I would steal food and even money to get, from I remember stealing money out of my parents' wallet to get money to sneak food. I mean, these are the behaviors of an addict. And so this is what I thought, that's what this is. And now I have sugar in my home and in my diet, and it's not a thing. It's completely fine. There's no energy around it. And I see this with clients as well. And so I think that there's a lot of belief out there. And I see it with clients who come to me saying, I'm a sugar addict. Can you please help me? And then we come to, at the end of it, it's like, oh, I wasn't actually a sugar addict. I'm not actually a sugar addict. There's sugar in my home. But when we have the fear built up, that's all absolutely reinforced in wellness culture. There is an energy then around those foods, and it's a high stakes food. And when that's a psychological setup for using that food in a way that looks like we're addicted to it. I mean, it's a classic scenario. And I find this to be the one that people really resist the most as far as believing that it's not an addict issue.
Yeah. I like to talk about the science of it, because I mean, you and I know in our practices, we know this not to be true. We see this all the time. People who come in really feeling and having struggled with what feels like or what they believe to be an addiction to a particular food or substance, usually sugar, but sometimes just food in general. And when we go over the science and the evidence that we have to date,
there's quite a bit of evidence that it does not exist in the same way that a substance use disorder with drugs or alcohol or even, medications can, because those substances hijack the brain's reward system and create levels of dopamine that are above and beyond physiologically normal levels. So, of
Yeah.
course, when we stop that response, we stop the drug, we stop the substance, and the levels plummet, it creates a situation where strong, intense cravings are experienced, but also symptoms of withdrawal. And
Mm-hmm.
those are two important criteria to meet the substance use disorder definition. We don't see that with food of any kind. And we conflate reward and the reward cycle with addiction, and they are
Right.
not the same thing.
Right.
We can experience pleasure and reward and not become addicted to it because we're human beings and we're wired for pleasure and reward.
Right.
And that's what happens with food. We enjoy foods, we experience pleasure as part of the reward cycle, but we don't become addicted to food because we cannot achieve those super physiological levels of dopamine that are created with substances. And so, and we also don't ever see the withdrawal symptoms. And, people aren't losing their jobs, their homes, and their families
Yeah.
when they stop eating sugar. They might experience discomfort because they no longer have the coping mechanism or they're choosing not to use that coping mechanism, but they don't have to be hospitalized for
Right.
symptoms for DTs. So I think understanding the science also helps to just maybe take some of the fear out of it, because that whole addiction conversation just drives
Mm.
fear and panic where people like don't even want it in their circle of friends. Like I've had
Yeah.
people say that they had to like get new friends because their friends wouldn't stop bringing sugary desserts to potlucks.
Yeah. Oh
Like it's
gosh. Yeah.
heartbreaking, heartbreaking, right? So just to
Yes.
kind of tack on one more thing, the other interesting thing about addiction research that I'm sure you know is that, it's the behavior, the behavior of restriction that creates the craving, which
Right.
really ties into everything we've been talking about, that when we don't allow ourselves access to something that we enjoy, we will want more of it.
Yeah. Right.
So coming back to permission, right?
And the physiology too. And this won't apply to everybody who binge eats, but a good number of people who binge eat also restrict, and so their weight may be suppressed even by just a little bit. And again, that doesn't have to mean that you're underweight. Absolutely not. It just
Mhm.
might mean that you're less than your body wants to be. That you're might be. I mean, I was of an average weight, for. In fact, I was probably overweight according to the BMI, but I was restricting and I was under my body's set point. That was enough to drive what felt like it was a primal drive for food that would come over me when I would open a floodgate, that I would call it, like opening the floodgates. But that was a physiological, like my body was hungry. My body was chronically hungry and pointing me towards food, in the same way that we were not addicted to going to the bathroom. We just need to, you know what I mean? Like
Yeah.
that will just show up. And hunger that comes from that I need food kind of survival place feels addictive, but it's really just a biological drive. When I reached a certain point in my body, when my body reached a certain weight range, a lot of that really quieted. I mean, there were still the psychological pieces, but there was something in my body. I could feel like that urgency. If anyone listening binge eats, there's that I couldn't even wait for bread to toast in a toaster. Like 30 seconds was too much to wait. I could not wait. That primal urgency of food was hunger, and that's different than food addiction.
Yeah, absolutely, absolutely. So what would be one other thing that you would love people to know about binge eating? That can be a factoid, bit of info, myth, but just kind of what do you feel like is something that's really important that isn't talked about enough or needs to be said more?
Oh, all of it, all of what we just said, but that, first of all, I think that a lot of people with binge eating think they're broken, and they think that that's just the way that they relate to food. And I this is why I do what I do, because I felt like that too, and that was just my belief about myself and my body. Even it was like me against my body, and that is something that you're not broken, and that this can be worked with. and that might require like some kind of looking at physiology. I have like a three-pronged approach to it, like physiology, cognition, and the mental constructs, and nervous system and emotional regulation, and that any one of those three things in a where it lands in a dysregulated way might show up as binge eating, and that these underlying factors are the place to go, more so than how do I reduce the amount of food I'm eating. I think the typical way of thinking about binge eating is how do I eat less? And that's the surface goal. And as long as we stay focused on that, I don't think we recover. Going deeper into the emotional dysregulation, the mental and the physical dysregulations, and everything that goes along with that, which usually has to do with like a whole web of factors, is the area to focus on, and that these are the things that need more attention than the food, actually.
I think that's a great reminder. So thank you for sharing that. Thank you so much for joining me today. I know that this is going to be really helpful to a lot of people, because so much of the binge eating conversations aren't really talking about it other than just like, what is the fix? Like, what do I need to do to fix this? Instead of really getting into a little bit more of like, what are the things that are around the binge eating and not just the binge eating itself? So thank you so much for sharing your wisdom with us.
Thanks for having me.
So what do you think is the missing ingredient in midlife?
I don't know if you get this one a lot, but I just turned 45 in June, and more and more, like, I feel like I'm just getting more messaging around connection. And it's like, I've studied for even in my own quest to recover, it's like, all right, what do I need to know? What new training do I have to do? What do I have to read about? What do I have to research? And it's like, sometimes the most simple truth of feeling regulated inside of myself is like connecting with other human beings that make me feel safe. That is the most powerful antidote, and it's the simplest. And so I'm in an active process right now of like remembering how to have that balance between work and passion and intellect, with being in my body and being with safe people and being in my life, like being in that first person living experience, which I think that anxiety and pressure can corrupt a bit. So there's this body and connection and social connection piece that I'm really into right now.
Awesome. That's great. I love that. So where can people find you?
I am on Instagram, and I will be on YouTube, hopefully within the next couple of weeks, at I am Stefanie Michele. And I have a website at iamstephaniemichele.com.
Perfect. And we're going to have those links in the show notes as well. And so this is coming out in September, October. So we'll have all your links, including YouTube and everything up. But thank you so much for joining me today.
Thanks for having me.